Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
When you or a loved one is sick or gets injured, you want to get them help right away. But the question is, should you go to the emergency room or should you take them to your local urgent care center? On today's show, we will explore each option. Plus, we have an emergency room doctor from Baptist Health here to answer your questions. And that's all coming up right now on this episode of Ask the Doc, No Appointments Needed. Hello and welcome to Ask the Doc, No Appointments Needed, the show where the health questions you sent in are answered by our doctors and medical experts. And thank you so much for joining us today. I'm Kathy Buccio, and I'm very pleased to be joined by Dr. Ari Davis, emergency medicine physician at the Baptist Health South Florida Emergency Room in Miami Lakes. Thank you so much for joining us today, Dr. Davis, and for your time, most importantly.
No, my pleasure. Thank you so much for having me.
Well, I personally have questions myself, so this is fantastic. So let's get right to some of those questions from our viewers. And first up, we have Paula. She emailed in and she asked, sorry if this sounds like a silly question, but what's the difference between going to an urgent care center and the emergency room? Paula, thank you for writing in. I mean, I think this one is a great question. It's not silly at all. Dr. Davis, I know a lot of viewers out there are probably asking themselves the same thing. So please share some of the differences between the two with them.
Yeah, this is a great question and one that I get asked by patients all the time. So urgent care is great for certain things. It's great for small cuts and bruises. It's good if you can't see your physician in a timely frame. It's good if you have a cough or a cold. The emergency department, though, is typically staffed to be able to handle more complicated issues. So life-saving, life-threatening issues like heart attacks, strokes, major bleeding, trauma, anything that can be more life-threatening, the emergency department has more capabilities to be able to handle more complex issues.
Thank you, Dr. Davis. And this next question comes in from Aaron, and he writes, when someone isn't feeling well, how do they know whether they should head to the urgent care or go straight to the ER? Again, another great question that I think people often ask, myself included. So what would you tell Aaron, Dr. Davis?
Yeah. So, Aaron, another great question that people get confused with sometimes. So my general rule is that if something feels new or sudden or life-threatening or emergent, it's always better to go with your gut and go to the emergency department. And the reason why is because we have more capabilities. We have the ability to admit you to the hospital. We have the ability to give you IV medications. We have the ability to get advanced imaging. So if you think something is doesn't feel right, I always tell my patients to go with their gut. And you can never go wrong with going to the emergency department. And that being said, the urgent care can also be a really good tool if you want to go somewhere that's a little bit quicker, a little bit more cost saving. And if you go to the urgent care and you need to be in the emergency department, they'll send you there.
Absolutely. What about x-rays? I always have that question. What if something needs to be done? Can that be done in an urgent care, or do you have to go to an ER for that?
So all ERs can do x-rays, obviously, but some urgent cares can. The urgent cares have different capabilities. Some even have the ability to do CAT scans nowadays, but often they do have the ability to do x-rays.
Thank you, Dr. Davis. Okay, another question. This one's from Rhonda, and she reached out through Facebook, and she writes, I am the caregiver for my parents who always complain about one thing another hurting. I don't usually overreact, but after watching the show now, and I want to know if there are any red flags that tell me I need to go to them, to take them straight to the ER. Okay, medical issues that require immediate emergency room care, Dr. Davis, what are they?
So, first of all, it can be hard to deal with parents who are caregiving for another person, especially if that person has other comorbidities or complications. But things that I typically tell people that are red flags are sudden confusion, altered mental status, or changes in behavior that are really sudden. Any types of persistent fever with high heart rates or kind of looking lethargic or passing out, anytime somebody has loss of consciousness or weakness to one side of their face or weakness to one side of their body or slurred speech, that's another indication of possibly a stroke. And anytime somebody has chest pain, shortness of breath, severe abdominal pain. The last one I think that's really important is if you have a family member who's taking aspirin or any anticoagulants or antiplatelets, and they have even a minor fall, it's best to get them seen in the emergency department right away because it's just safer to do it that way.
Let's keep it going, Dr. Davis. Our next question comes in from Chris, and he writes, when my young daughter got sick last year, I wasn't sure where to take her because I didn't know if an ER or an urgent care center is better to handle a sick child. What do you think? Dr. Davis, this is a great question. I'm a parent myself, and sometimes I am faced with this situation, urgent care or ER. So what type of facility is better suited for children?
And I think this can also be really difficult for first-time parents as well who don't know, they haven't had a sick kid before. I like to start off by saying that parents know their children better than anybody. So if you think something's wrong with your child or you feel something is not right and your gut tells you that something's not right, go straight to the ER. And the reason why is because the ER is trained to recognize and treat medical emergencies in pediatric patients, adult patients, and infants as well. And so if when in doubt, it's always safer to go to the emergency department. And there we have the ability to get intravenous access where we can give fluids, we can give medications, and we can also admit to a pediatric hospital if that's required as well. That being said, I think for things that appear less urgent, things that you might go to your primary care doctor for, like a sore throat or an ear infection or a stubbed toe, that's a great place to go to the urgent care for. But if you think your child is sick and you feel like something is not right, trust your gut and go to the emergency department.
I learned very early on, Dr. Davis, as a mom of two kids, the fever. The fever is a big indicator of where you're going, whether it's urgent care or ER. Is that correct?
It is. I also like to say that that another good one is how much if your child's drinking or eating. So if your child's not drinking fluids, that's a really good indicator that your child's going to be dehydrated. But persistent fevers that do not come down or continue to rise, that's a warning sign that you should come to the emergency department. Yeah.
Thank you, Dr. Davis. Okay, next we hear from Taylor, who writes, my husband was feeling ill, so he called to make an appointment at our primary care physician. Believe it or not, they told him they don't see sick people in the office and he should schedule a telehealth appointment. Is that the standard at urgent care as well? And if so, how does telehealth impact the decision of where to go? Taylor, thanks for your question. Dr. Davis, I'm a little bit surprised to hear Taylor's husband couldn't be seen at his primary doctor's office, but I'm wondering as well if that is now becoming sort of the common occurrence. And can you talk a little bit about that and how telehealth works in conjunction or compares with the urgent care centers?
Yeah, so I think it's a good system. It can be a little bit complicated as there's a shortage of primary care doctors right now. So sometimes people can't find a primary care doctor, or their primary care doctor has too many patients, they can't see you immediately. So I will say that there's no substitute for a primary care doctor. We love primary care doctors. They are the backbone of the medical system, and they know you better than an urgent care doctor or an emergency doctor knows you. So the better your doctor knows you, the better they're going to be able to treat you. That being said, if you cannot see your primary care doctor and you can see a telehealth doctor, I think that's a really good opportunity for them to be able to tell you, hey, I think this may need to go to the emergency department, or hey, I think you can go to urgent care. So I would use them as maybe like almost like a lifeline to say, where should I go? And the urgent care can be used for, if you can't see your primary care doctor, the urgent care is a fantastic place to go if you have a simple question or a simple need that can be non-emergently fixed.
Great, Dr. Davis. Thank you. All right, let's get back to more questions. We have Alice who writes, my mom wasn't feeling good, so I tried to take her to urgent care. She hesitated because she said she wasn't sure about the quality of doctors and nurses at the urgent care centers. Can you reassure her about the staff so that she will go to urgent care next time? We're watching the show together and look forward to hearing your answer.
Yeah, so The urgent care is staffed by the same credentialed doctors and nurses that are staffed at the emergency department, and they are fantastic. They give fantastic care. And oftentimes, the urgent care sees cases at urgent care that I don't see at the emergency department, and they're almost sometimes better at seeing those things that are appropriate for urgent care. So they see them more often, and so they're more adept at treating those things. So they're highly qualified doctors. They're all board certified doctors and nurses, just like the emergency department. And like I said, if they'll know if something's too complicated for them, and they will say, "We think you need to go to the emergency department," which is totally fine as well.
Oh, I hope that's reassuring to Alice and your mom if you're watching. Thank you, Dr. Davis. We're going to keep it going now. Charlie, he reached out on Instagram and he writes, I first went to an urgent care center during COVID to get tested. My question is, are these centers capable of doing other tests as well? If so, which tests should I get done there and which tests need to be done at the ER? This sounds like a question many viewers would be interested in. Dr. Davis, what can you tell Charlie?
Yeah, so it's kind of like we were talking before about x-rays. So the urgent care can do a lot of different tests, and different urgent cares can have different capabilities. So you can get COVID testing done, rapid flu testing done, strep testing. Some of them have the ability to do basic x-rays. Some have the ability to do CAT scans, but that's a little bit rarer. They also have the ability to test for urine, so for urinary tract infections. But at the end of the day, I would say, leave it to the doctor to tell you what type of test you may need. But just know that there are more capabilities at the emergency department, but the urgent care does have the ability to do a lot of different testing.
Well, we just got a question from Rachel, and this time from our Facebook page. And she writes, my son was playing soccer when he crashed into another player and dislocated his elbow. They rushed him to the hospital for treatment, but could have asked to go to an urgent care center. Would they be able to handle a serious injury like he's had? Rachel, we hope that your son is okay. And that has to be really, really scary as a parent. I can't even begin to imagine. Dr. Davis, what would you tell Rachel about treating her son with a dislocated elbow, and should she have gone to urgent care?
No, I think this is like in the game of Monopoly. Like, don't pass go straight to the emergency department in this scenario. This is a perfect example of what's a great case for the emergency department. So when your child dislocates their elbow, not only are they going to need medications to help them be more comfortable and have pain medication, but they're going to have to get advanced imaging like an X-ray or maybe a CAT scan, and then probably also a consultation with a specialist, which we can do in the emergency department. So for a lot of different reasons, that's a fantastic case that utilizes all of the great modalities that the emergency department has that urgent care doesn't have. So that case, they did the right thing, and they brought your son to the emergency department.
Well, I'm knocking on wood. I am not there with the broken bones, and hopefully won't.
Not great. Yeah.
But let's get to our next question. It's from Sergio, who emailed in, and he said, our insurance isn't good, and we have a very high deductible. Is there a difference between urgent care and the ER when it comes to insurance coverage? This is a fantastic question, Dr. Davis. And I think that it's one that really impacts the lives of many people. So what would you say? What would you tell Sergio?
So Sergio, great question. So the emergency department is inherently more expensive, and that's because they deal with more complicated issues. So typically that bill is going to be more expensive because they're doing more advanced testing, they're doing more testing, they're giving more medications, and you're getting higher levels of care. So it is going to be more expensive. That being said, all insurances are legally responsible to cover emergency room visits, even if it's in or out of network. But the urgent care can be a fantastic place for a little bit cheaper care if it's something that's reasonable to go to the urgent care. You can be a little bit faster, a little bit more time saving, like I said, and it can also be a little bit cheaper. But it is a little bit more expensive. That being said, if you're having an emergency, you need to go to the emergency department.
I'm so glad we were able to answer that question, though. Thank you, Sergio. And our next one comes from Raul, who reached out to us on Instagram, and he writes, my back hurts, so I went to my primary doctor. After checking me out, he said I may have kidney stones, and if it gets worse, I should go straight to the emergency room. I don't like hospitals, so can I go to urgent care centers? And if so, what can they do to help me? Well, first of all, Raul, I hope you feel better soon. And Dr. Davis, what options does Raul have, and what can you share with him?
Sure. So kidney stones can be complicated. Sometimes they can be fairly straightforward, but sometimes they can be complicated. They can be extremely painful. They
Mhm.
can require IV hydration, intravenous hydration. They can require getting a CAT scan. And if they're obstructed or causing an issue like an infection, a lot of times the stone needs to be removed in the hospital. So generally, this is something that's better taken care of in the emergency department because we can speak with the urologist, we can admit you to the hospital, and we can get it taken care of all at once. Um, if it's somebody who has a known history of kidney stones and they say this feels exactly like every other kidney stone I've ever had in the past, maybe they could get by going to urgent care. But I think that's a more rare case. And I would say most of these cases should be taken care of in the emergency department. And it's just better overall for your care.
And Dr. Davis, since we reassure Raul too, I mean, I don't think anybody likes a hospital visit, but I have to say the Baptist Health team is one of the best and always making their patients feel number one and feel safe, correct?
Yeah, yes, I always tell patients when they're being admitted to Baptist, it's more of like a vacation away from home than it is like going to the hospital. So it's nice, it's pleasant. I think everybody has a great experience. If you have to be in the hospital, it's a great place to be.
Thank you, Dr. Davis. Okay, next we hear from Brian, who asks, my young son ate what we thought may have been a poisonous mushroom a few years back, so we took him to the ER. If that happens again today, how is that treated? Is that something that we can bring him to urgent care for treatment? Is there anything we could do at home? So, Dr. Davis, what is the normal treatment plan then for what Brian described? And is that something that maybe the urgent care could have handled instead of the ER?
Actually, this is something that the parents could handle from home initially, and that is you can always call the poison control center from anywhere, and they can tell you exactly what to do. And when a patient like this comes into the emergency department, the first thing that I do is I call the poison control center so they can help me as well. So even from home, they can call the poison control center. You can go online. It's a toll-free number, but it's typically better to go to the emergency department because we can get treatment started faster. Depending on what type of mushroom it actually was, there's different types of treatments, but it's always better to get treated quicker for these things. So going straight to the ER instead of the urgent care for something that could be toxic, or if there was a possible like substance issue with something like taking too many pills or something, or taking the wrong pills if the parent's taking the wrong pills, just come to the emergency department.
Thank you, Dr. Davis. We have another question that came in. This one's from Giovanni, and he writes, my wife takes a lot of over-the-counter vitamins and a few prescription medications. We recently went to an urgent care center, and she didn't tell them about all the things she is taking. I told her how important it is, but she said it's not her doctor, so she doesn't see the need to mention it. How important is it to tell your doctor about all of the meds that you're taking? Dr. Davis, I would think it's very important to share all of your medical history with medical professionals, especially if they need to get a picture of your family history and what's going on with your overall health. Is this true?
Yes, it's especially true for the emergency department because this is the first time we're seeing you. So I don't have the pleasure of knowing you for many years and being your primary care doctor. So the more information you can give your doctor, your provider, the better your care is going to be. That even because of the case that many different medications cause different side effects, sometimes people come into the emergency department and their medications are what's causing their symptoms. Or I want to prescribe you a medication and it might interact with the medication you're currently on. So it's always more helpful for us if you can give us as much information as possible because it will eventually lead to better care for you.
Here's one question I have for you, Dr. Davis.
Sure.
We have things like the flu, the stomach bug, strep, things like that. Does that require an ER visit if the symptoms get too bad? Or is that something that urgent care can do? Or is that something that maybe you just take care from home?
Great question. The common cold, the common flu, COVID, if it's just, you're able to drink, you're able to eat, you just have some low grade fevers, but you can take Tylenol and Motrin and those fevers are going to go away and you're just not feeling well, typically that can be handled at home. If you think that you would like some other medications to relieve the symptoms, I think urgent care is a great place to see, okay, maybe is there something else going on? Maybe could I possibly have early pneumonia? And do I need to get a chest x-ray? Then urgent care can be a good place to go. I would say the emergency department is where you should go when you're feeling like something is really wrong, like you can't breathe, You feel like you might have severe pneumonia, severe symptoms, you might have a severe infection. So a lot of times urgent care can be a really good place to start. If you're just having mild symptoms, typically that can be handled at home. And if you're having any concerning symptoms that are new or changing, then that's when you need to go to the emergency department.
Thank you so much, Dr. Davis. I love that we have the questions still coming in from our viewers. Keep sending them in. Question from Patrick, this one on YouTube. I've been getting dizzy at bowling practice. Should I go to urgent care?
So Patrick, another fantastic question. So dizziness can be a sign of multiple different things. It could be as simple as dehydration. It could be a sign of your sugar is low, but it could also be a sign of a potential stroke. And whenever there's a concern for a stroke, it's always better to go to the emergency department because we have the ability to urgently care for strokes. And with strokes, you want to treat them as fast as possible. So if you're ever feeling dizzy or lightheaded, it's always a good idea to go to the emergency department over the urgent care.
And Dr. Davis, when there's a head injury involved, whether it's a child or an adult that maybe suffers a concussion, or is that something that requires an urgent care, or do you something for that you go straight to the ER?
That's a great question, and every case is a little bit different. So it depends on the mechanism of the head injury, the age of the person, if there's any medications that were taken. So if there's if the head injury was mild and there's no confusion and no loss of consciousness, and that person can tolerate oral intake and they're acting normally, oftentimes that can be handled by the urgent care. But if any of those things are not true, then that requires an emergency department visit 100%.
Absolutely. I have one more question. It's from Pamela. She has a question that just came in, and then I'm going to follow up with my own question. And Pamela, let's see what you have to say. My husband lost vision in his right eye suddenly, and he didn't want to do anything about it. He said it would get better, but I wanted him to go to the ER immediately. His vision came back after an hour, but it really freaked me out. What should we do if it happens again? I mean, that has to be a little scary for Pamela and her husband. What would you say, Dr. Davis?
Very much so, and that is a very scary situation when a person loses vision. And what I would say is that requires you need to get your significant other to the emergency department right away, because that could be the sign of an early stroke.
Wow.
And so that get that person to the emergency department, even if they don't want to. Tell them that's best for their care, because even though the vision came back, it could be a sign of an early stroke, and we can do something about that if you get in early.
Absolutely. Thank you, Dr. Davis. Now, we're almost out of time, but I think it's important that we recap. We learned so much today, Dr. Davis. Thank you.
Yes.
And we want to recap for our viewers when to go to the ER, when should they go to urgent care. Give us the Clip Notes version of that one.
Sure. So, when to go to the emergency department over urgent care. So if you have anything like chest pain or chest pressure, that can be a sign of having a heart attack. If you're having difficulty breathing, those can be signs of having an asthma exacerbation. That can also be a sign of having a heart attack. Pain in the arm or the jaw. This can be seen. This is a classic symptom of a heart attack or myocardial infarction. Other things can be like profuse sweating, nausea, and vomiting can also be signs of having a heart attack. Any type of poisoning or overdose from drugs or alcohol needs to be seen in the emergency department at the direct emergency department visit. If you're having persistent seizures, new seizures, any serious injuries with heavy bleeding or large open wounds, please come to the emergency department. We can handle that. Do not go to urgent care for that. Severe allergic reactions, if you're having any trouble breathing or severe swelling or nausea or vomiting, those can all be signs of having an anaphylactic reaction. And any type of severe burns, from chemical to any type of water, all of that come to the emergency department.
Thank you, Dr. Davis. And unfortunately, that's all the time we have for today. I cannot thank you enough. Our viewers cannot thank you enough for your time, for your insight, for your explanations. Thank you for joining us. And thank you everyone out there for sending in those questions for Dr. Davis. We kept him on his toes. He's fantastic. I just want to say I'm Kathy Buccio, and we'll see you next time on Ask the Doc. No appointment needed. Bye for now. Thank you, Dr. Davis.
No problem. Thank you so much.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.